Hi, welcome to today's AskAwayHealth Friday live class. Thank you for joining me. I'm Dr. Sylvia, a general practitioner, and today we've got two great questions from my viewers that like us to tackle, and they're all around how the emergency pill works. So let's just dive straight in. I'm going to put up on the screen so that you can see the question with me. I did a little clip of the question. I thought that was easier because it would have been just too big to put on the banner for the stream. So this question, like I said, it's from a viewer. And remember, on our live class, what I love to do is address questions that come from viewers, either from the topic that I've published a video on or something related. I think it's a really great opportunity to discuss it with you here. So this question says, I had unprotected sex on the 2nd of May 2022. On the 3rd of May, I went on my period. On the 4th, I took the emergency pill. I then had sex again on the 8th of May, and it was the last day of my period. I took the pill again on the 9th of May. Now my period is 6 days late. I did a test. It was negative. Now the questions. Could I be pregnant? Could it be the pill did not work? Are these side effects or what? Please assist. So genuine question, and we're going to go through the question, go through the bits of information that they've provided, because that would help us get to some degree or some form of answer. So this is someone who's taken the pill and is worried about whether or not it's worked. And if you're not aware, if you've not seen it, I do have a video on the channel, or a couple of videos where I talk about why the emergency pill might not have worked. And I also talk about, I've got a video that talks about signs that indicate whether or not the pill has worked. But let's get into this question. And I've got a series of images I'd like to share with you, because I thought it was really good to be able to look at the dates that they've provided in detail, and that would help us too. So I'm just trying to share my screen. Give me a moment. I thought that would help us to tackle the different issues properly. So let me just bring up the files I've got somewhere on the system. I think these are the ones. So let's see, is this correct? Okay, so that's one. Bear with me. These are the joys of technology. So I think it's that one. Okay, and if you're coming into the stream, so I'm just going to share my screen with you. Hopefully you should be able to see this stream. And if you're popping in, say hi. Hello, Antoine Leons. Thank you for joining in. Drop a comment if you've got a question on the topic. But thank you so much for joining us today. So let's get the screen share going. So hopefully you should be seeing the image I've got, which is of a calendar. And on this calendar, I've put and color coded the different bits of information that we have. And that's what's important. That's what your doctor is considering, given the dates and the events that have happened. And please remember that this is an estimation exercise. I always say in my videos, it's an estimate. Even ovulation that we use ovulator predictor kits for example, these are still estimates based on body temperature or the nature of mucus and so on and so forth. But even in a lady with regular monthly periods, it is possible that ovulation might change from 1 month to the next. And you might say ovulation is going to happen on this particular date, but you may be off by a few hours or by a day or so. So there are still estimates. And even in the laboratory, we haven't been able to narrow down to the very last second or hour or minute when a woman is ovulating. There's still estimates. But going by the information that our ladies provided to us, so she said to us that she had intercourse on the 2nd of May, and then her period started the following day. Then she took the emergency pill the day after that. So if you can see my calendar, the May 2022, we've got the meeting with her partner on the 2nd, and then her period started the day after and taking the pill on the following day. So this tells us that she's taken the pill 2 days after she met with her partner. Now, this is good. It's within the recommended period where you're supposed to take the pill. I don't know which type she took, but for the common ones, for the levonorgestrel example, progesterone pill, what you're asked to do, what you're recommended is to have the pill as soon as possible after intercourse, and nothing after 72 hours, or nothing longer than 72 hours. And what that means is, the sooner you take it, within the hour, within the day, that is within the first 24 hours of meeting with your partner, then the more effective it is. If you leave it to day 3, the 72 hours, it's going to work, but its activity is less effective compared to if you're taking it on day 1. But she took it within 48 hours, so that's fine. She's still within the recommended period of time. Good. So let's go a little bit down the calendar. She then says, we come to the 8th of May, when she says she met with her partner again. And that was also the last day of her period, indicated by my sort of nice little pinky drop of blood there. And, and she took the pill again afterwards. Well done. Well done. And why am I saying well done? Two reasons. Number one, she took the pill as soon as possible after meeting with her partner. That's number one. But the other thing, which I think we doctors and nurses who give advice about sexual health and using the pill, sometimes forget to remind you that if you've taken the pill on a particular day, you know what the pill does. This is the emergency pill I'm talking about, please. We've got the levonorgestrel types, and we've got Ella, for example, the ulipristal type. If you don't know, if you're not familiar with them, please go and check out my playlist on smart birth control. I do talk about them there. But the point is that they work by delaying ovulation. And they work by delaying ovulation, according to the studies, for up to 5 days, the period of time within which you'd expect that viable sperm would have died off already. And then ovulation happens. So imagine you've taken the pill, it delays ovulation. So if ovulation is hanging back, it's waiting to happen, it is still going to happen. Please don't forget. It is still going to happen. And then you have intercourse again. And you're busy thinking, oh, I had the pill a few days ago, I'm sorted. No, you're not, darling. So you would need to either have started a regular form of contraception, use the condom, or if you haven't done any of those things, you will need to take another pill because you're just about to ovulate. And with this second bit of intercourse, you could get pregnant. Okay, so that's why I said she's done the right thing. I gave her kudos twice because of what she did. And then I've shaded the next few days along our calendar. I've color-coded them because they tell us a few interesting things. And to explain what they tell us, I need to take you to the month before. Remember, she told us that her period started on the 3rd of May. Now, that's useful information, especially if she has a regular cycle. Now, I don't know if she's got a regular cycle. And this is why when you bring these questions on YouTube, the response you get is very, very general, because it's not the place where you can get the information you need that's specific to your need. But don't worry, we do have our email service on AskAwayHealth where you can send an inquiry, and I or my colleagues on the team will respond, and it's specific to your background, provide information that will help you make your decisions and so on. But anyway, back to our question. So we're going to go back into time, and we're looking at April. So she told us that her period in May was on the 3rd. Assuming that she has a regular cycle, we can sort of predict when she may have had her period in April and when she might have ovulated. And that's what I've done in this on this calendar, just to give you an idea of how we sort of estimate these things. So possibly if she had her period on the 3rd of May, she would probably have been ovulating 14 days before. And again, these are estimates. Please don't forget they're estimates on the 14th of April. And that brings us to that interesting term, which if you're a regular viewer on my channel, you should be familiar with, your fertile window. But let me define it again, just in case you missed the lecture on fertile window. So your fertile window refers to that period where you are most likely in all of your cycle to fall pregnant, okay? And it is defined as the ovulation day and the 5 days just before it. Some people even count the day after ovulation because they're thinking the egg might survive sometimes up to 24, 48 hours. But usually the egg survives 12 to 24 hours. So we're saying that your fertile window is a sort of 6-day period where if you have meet with your partner during that time, you're most likely to fall pregnant. And can I just add that in terms of falling pregnant during a woman's cycle, there's some days where it is less likely to happen. For example, during your periods. Theoretically, those are the times less likely to happen. But according to the Faculty of Sexual and Reproductive Health, you could potentially fall pregnant at any point in your cycle, except when you're during your menstrual period. And the most likely time is during your fertile window. So this is what this tells us. And why did I bring it up? Because I can pull that into the following month and identify her fertile window of May. So looking at it from a broad point of view, she met with her partner around the time of her period. So already she's in sort of the low risk of falling pregnant kind of area, which is fine. But there's always a little but. So that's why it is sensible to use the pill. Don't say, oh, well, this is a safe time. It's around my period. I'm not going to fall pregnant. Please, please take it as soon as possible after unprotected sex, okay, or protected intercourse. Now, the last thing I want to, so her ovulation day, sorry, let me just clarify on this picture if you can see it with me, and I hope you can see it. Let me just double check that I've got you. It's showing quite clearly because I want to make sure that you've got that. So, yeah, so on that screen, hopefully you can see that I've enlarged it. So on this screen, the 17th of May would have been her ovulation day, given her date, given her period that she provided to us. So about 14 days. And again, is an estimate. So her fertile window would have been around the 12th to the 17th of May, but she'd already had intercourse. And then going by her date again, we can estimate that possibly, assuming she did not take these pills, these two pills, if they didn't interfere with her cycle, probably her next period would have come around the 31st of May or early into the month of June. So that's why I've got another color code and a drop of blood here. So that little bit of information that she's giving us tells us what's going on there. Let's go back to the question because I thought it was useful for you to have an understanding of the different terms. I'm going to stop sharing my screen. Have I stopped sharing? Yes, I've stopped sharing my screen. So we should be back on the question now. And we've gone through the details. So we got to the point where she took the pill again on the 9th of May. And I've said well done to her for doing that. And I explained why I've said so. And now her period is 6 days late. So remember, she was expecting her period to come probably around the 31st or very early in June. Now, I got this message. When did this message come? A few days ago. I can't remember the exact date. But at that point, she was saying her period was 6 days late. She's done a test and it's negative. Could I be pregnant? Those of you paying attention will already be spotting and thinking, well, probably not. Because why? Okay, not only did she take the pill, and she took the pill appropriately twice, so well done for that, but she was also in that period of time, that part of her cycle, that time of her month, when the chance of pregnancy is lower. She was not within her fertile window. So could I be pregnant? Probably not. I can't tell her no. I can't tell her blank no. I can't do that. No one can do that. But we can estimate that probably not. Then she says, could it be the pill did not work? I get this question a lot. Could it be the pill did not work? It is always a possibility. It's always a possibility. But I would not say that the fact that she hasn't got a period is not because the pill did not work. I think it's rather the side effect of the pill. And again, it is on my channel. Lovely explanatory video. Please go and watch about the possible effects of the emergency pill on your period. So she's had not one, but 2 emergency pills. And yes, that could affect your cycle. At the very least, it would either delay the period or it might bring it forward, or in some women, they have the period about the same time. The pill doesn't do anything to their periods, but any of those scenarios could happen. Okay. So the fact is that in this instance, since she's taking 2 pills, taking more than one usually, we're told it's not harmful. There are no studies or evidence that suggest it could cause any harm. But the truth is that they could make your cycle irregular. And in some ladies, that might be that the next month's period is a little bit delayed, or the one after that. Sometimes we don't know how long it might last for before things come back to normal if she doesn't take any other hormones. So that is the answer to that question. We've gone through the time that she met with her partner. We've gone through the time within her cycle when that happened. So we've said that was in a safe part of her cycle. We've established her fertile window, and we've talked about the effect of the pill. I think it's really important that you shouldn't go away thinking that if you have a bleed or if you don't have a bleed, then that means the pill has worked or not. In my video, I said, no, you don't rely on any of those signs. Because some women may have implantation bleeding and they're thinking, okay, all right, that's fine, that's the pill that's worked, but the pill didn't and they're actually pregnant. So that is a possibility. So please bear that in mind in terms of the possible reasons or the things to do with whether or not the pill will work. So that's that question. I hope that that response is clear. And please let me know. Of course, you're free to send a question in. If you wanted any more clarification on that particular one. So I would like to go on to the next question, again from one of my viewers, and I thought it was a really great question. Let me just make sure that it is going to be fantastic. So let me make sure that you can see clearly. So let's read this one. If the emergency contraceptive works by delaying the egg by 5 days while the sperm is viable for 5 to 7 days, isn't there still a chance that the egg might be fertilized? After all, the sperm is still alive. So this is a really great question, and I think it came from a guy. I do get guys watching the channel as well. So thank you for that question, because it's really smart. Overall, sometimes going into too much detail about when the pill is going to work or when it's going to work, sometimes it might defeat the purpose, because the key thing is you're better off taking the pill, because there's always a chance that it gives you some protection compared to not taking it. In a previous video, I have said that the emergency pill works by delaying ovulation by 5 days. So it delays the egg, but that's ovulation, please, in case you didn't know what that means. Ovulation means the release of the egg from a mature egg from the ovary. Okay, so if we say that the emergency pill does that, because there's still sperm that's viable and the sperm can be alive for 5 to 7 days. The query he had here in his question was, what about those 2 extra days? Well, listen, this is all research, okay? On average, sperm will live about 5 days. It is unlikely that you're going to have sperm in the majority of cases surviving beyond 5 days. But sometimes it could happen because, this is nature, this is medicine. We don't know everything. So trying to be very prescriptive and focusing on and not being flexible is not the best, I think, is what I'm trying to say. But generally, you have sperm that will have all died by 5 days, and that is why ovulation is delayed by these medicines for 5 days, up to the point when the sperm have all died. So the point I made to this gentleman is, this is why the emergency pill, is not 100% guaranteed. It isn't. That's the truth. It isn't. It is actually less effective than using a regular form of contraception. And this is what I'd recommend for people to do. Let me just get off the take this off now. Okay, and this is what I recommend to people, to use a regular form of contraception. If you're using a regular form of birth control, you have a higher chance of protection, whether this is the pill or the patch or the ring or the coil or the injection, whichever method that suits you and is safe for you. These are better than relying on the emergency birth control pill. Remember that the emergency pill, the emergency method, is meant for occasional use. It shouldn't be your go-to method. The go-to method should be your regular method, and that is actually more effective. But in the case that something happens and you need to use the emergency birth control method, it does provide you a degree of protection that you would not have if you did not use it. So I'm not going to be busy worrying about the extra 2 days when maybe it won't work, so why bother? No, that's not the right way to look at it. The right way to look at it is, if you're in a situation where you need to use it, using it is better than doing nothing. And then don't forget, of course, if you can, get the copper coil, the copper IUD fitted, because that is more effective. And all this story we're telling about 5 days or 7 days doesn't come into it at all, because the copper coil is more effective and is able to provide you better protection compared to the pill methods. So those are the 2 questions I wanted to cover in today's live class. Thank you so much for joining me. Please don't forget to go and check out the playlist I've mentioned. And if you have any questions, you can use our email health advice service. I'm going to put the links to that in the description box below. So you can contact us, use our service, get a rapid response from any of our clinicians. Check out the videos. This week I've published videos on fertility apps. Yesterday we had a video looking at, or the day before we had a video looking at fibroids, and then we had a video looking at heavy bleeding. So lots of things going on. How to look delay or postpone your period, particularly if you've got a big event going on. So go and have a look at those if this is the kind of information that you're looking out for. Thank you so much for watching, especially on the replay. Please like the video. I haven't even put up the banner. How naughty of me. Don't forget to like and subscribe. Yes, guys, please like and subscribe to the channel. And I hope you have a lovely weekend wherever you are. And I will see you again next week's live class.